Hello, everyone. Thank you for joining us today on the program, Healthy Living. Amadisuwa Usa Uwage. How common is the common catarrh is what we're going to be looking at today, because some persons will say, what's wrong with you? Is it not ordinary catarrh? Is it not common catarrh? And sometimes people say, oh, it's cold. Others will say flu. So we're going to look at the difference between all of this today on the program. How common is common catarrh? So we're doing catarrh and related illnesses today on the program. And joining me to discuss this all-interesting program is Honorable Dr. Patrick Okondia, as a Chief Consultant, Ear, Nose and Throat, Head and Neck Surgeon, a former Commissioner of Health here in Edo State, and of course he is the MD CEO of Wilborn Ear, Nose and Throat Clinic here in Benin City. It's a pleasure to have you join us this afternoon. The pleasure is mine. And I've always seen you from a distance, though, particularly during the COVID-19 era. Yeah. And you did quite a lot that period. Thank you so much. We appreciate you. Thank you so much. At least Edo State didn't get that much casualties like other states did. To the glory of God. It was a good thing. Yeah. Okay, so happy to have you join us today. You know, as a consultant in this field, people look at catarrh as common and as ordinary. Exactly what is catarrh when we're talking about this ailment?
I think it's very important to discuss this topic, okay. Because I think it's trending now.
It is. Yours truly is down with it.
Catarrh, as the word implies, is a common word, it's a common term. And in all honesty, catarrh itself is not a disease. Okay. It's only a symptom or sign of a barrage of diseases. Really? Yeah. So it's a discussion we're going to have today is going to probably go through some of those spectrum of the possibilities and causes of catarrh, and the need for us to start taking it seriously at a point in time. Like I said, it's just a symptom. Are we on? Yeah. So go ahead. It's just a symptom. Catarrh means the production of secretions through the nose. It can be due to allergic conditions, infective conditions, including viral, bacteria, and fungi. It can also be due to neoplastic conditions where we talk about growths, swellings and growth, whether benign or cancerous. Many of them can present with just this so-called common catarrh. It's in the course of the discussion, we'll be able to expatiate on all this. Of course, sometimes catarrh can present as a singular symptom that is on its own. On its own. Yeah. But most often times they present with other symptoms. The responsibility of the doctor and then the ENT surgeon is to be able to identify through appropriate examination and investigations to identify the recausative factor, and then the aim is to treat the cause, and when you do that, the catarrh itself will go. Though a lot of cases of catarrh are said to be commonly caused by viral infections. It's important to state that the season we are now is common. There are a lot of viruses in the air, and we know there are various types of viruses, including the coronavirus, the rhinoviruses, the adenoviruses. Though the coronavirus is a common virus that has been there in existence for many years, but if we take ourselves back to 2020, the COVID-19 was just a strain of the coronavirus. And of course, you know, it's an airway disease. So it's always there in the air, particular season, like in the rainy season that starts, and you see the flourishing of these viruses in the air. Depending on our immune status, ability or resistance to fight these viruses, we can come down with the infection and start to manifest with catarrh. We will also be able to identify the nature of the catarrh, the tendency, and the color, which can also determine the possible cause. Suffice to say, for viral infections, majority of them are self-limiting, in which case when you have it, you are expected to come out of it on your own without any form of medications. But bottom line is, it's all depends on your immune system and your ability to fight it.
Okay, but unfortunately, CATARRH is one, you just said it's not a disease though, it's not a sickness as it is, but it is difficult for one to just leave the house and go to the hospital because of CATARRH. But sometimes it presents with a lot of discomfort. You know, you have scratchy throat, sometimes sore throat, you find it difficult to breathe. You don't smell. Other times it comes with foul smell, discoloration, and all of that. Yet, people will not go to the hospital. So at what point is one expected to visit the hospital?
Yeah, thank you very much. It's a continuation of what I've said earlier. It may start as a simple viral infection, which is self-limiting. So when you start with this watery discharge from the nose, and at that time, there may be other accompanying symptoms like itching and sneezing, may become excessive. Of course, you could have other symptoms like the irritation in the nose and in the throat.
Other times, cough.
Yes. Of course, the catarrh actually can go backwards, just as the same way it comes out in front. In fact, in our parlance, we say the catarrh comes out in front. We even call that a good catarrh than the one that goes backwards. That's the one we refer to as a bad catarrh. You know, and that has the ability to cause more problems than the one that is running. What kind of
problems can that cause?
You just mentioned if a catarrh goes backwards and it sticks to the back of your throat within 12 hours and it's not there, of course it gets secondarily infected and it starts to exude offensive odor. Then the person starts to have what we call bad breath, or halitosis can set in. And of course, there are a lot of other structures behind the nose, especially the ears. The connecting tubes of the ears are related to the back of the nose. And so discharges to the back of the nose can actually spread into the ears. So sometimes the patient comes down with what we call referred otalgia, and the pains in the ear will develop. So catarrh itself can manifest in other distant symptoms. All right. The bottom line is, if you start to have the catarrh, and after a few days, it's not clearing, sometimes we expect that a viral infection within days, a week max, you should be out of it. If you now persist, I think there's need to start taking it seriously and start.
Like for how many days before you decide to go and see a doctor?
I'm using the 7 days.
7 days.
Mark, yeah.
Okay.
And of course, the most important. If the color of the starts to change from just watery, which is colorless, to start becoming yellowish, and in some cases start becoming brownish or even greenish, and in worst cases gets associated with some bloody stains, then those are very, very strong signals for you to start to consider seeing medical attention. So it's all these characteristics. But if you have just plain colorless discharge, even with the excessive sneezing and itching, that could be viral or it could be allergic. We may discuss that later. Allergic rhinitis. You can actually overcome it with your level of immune status. But when it persists beyond a week and things are changing, not for the better, but for the worse, then it's about time to see your doctor.
And let's look at the issue of recurrent catarrh, because some persons will keep catarrh like throughout the year. And it will not, maybe it might just a bit for a few days, and before you know what is happening, it comes back again. You know, it comes back again and again and again. And such a person, we have this very poor orientation to assessing healthcare. It's there, but we don't like to as Nigerians. So when it keeps reoccurring, and then the person tells you, I cannot smell, I don't have the ability to perceive smell, and then other times you just keep running non-stop and sneezing non-stop. You know, that kind of a person, what's supposed to be done to that person? And they will do self-medication. I know a particular person that does self-medication.
There are a lot of issues, because if we go into all those areas, we may probably not live here. Poor medical practice on the part of our people, seeking the wrong help from the wrong places.
Okay.
Of course, self-medication. If you have good knowledge, nothing wrong with that. But when there are limits to which you can help yourself. Even as a doctor, you are expected to see another doctor if you're sick. Yeah. So recurrent catarrh, going to the question, can be due to a lot of other factors. And this is where we could, first on the list would be the issue of allergies. Allergics are things that your body reacts to. You could have them any part of the house, on the air. You inhale them, your body starts to react. There are so many barrage of allergens, allergic factors that human beings react to. From just simple dust to what we call the house dust mites. Those are microorganisms that are released by even insects or even ants or even rodents in the house from their excretors.
Unfortunately, most of us don't even understand ourselves.
Yes. So the allergies are always there in the environment. We do have allergies to even fungi. Fungi are some form of microorganisms. You see many houses where during these rainy seasons like this, you see the edges of the wall starts getting greenish. It's actually, those are fungal growths within them. And the fungi has the ability to release spores into the air. And when you come in and you go in and you inhale, of course, you have the reaction will commence. And catarrh is one of those symptoms that manifest with that reaction. Nasal congestion, the nose gets congested, you start to itch, and then you start to sneeze excessively. All right. Of course, what those reactions will do is also to dampen your immune system. With time, secondary bacterial infection will now come in, and that will now manifest in symptoms like fever. All right, you start to have headaches. All right, and simple catarrh that would have probably stayed within the nasal cavity can now progress into special areas of the skull that we call the sinuses. So sinusitis can now set in, and you see somebody coming with heaviness of the head, and it's a particular form of headache. You feel your head is very heavy, you know, and so those are possibilities. Depending on how much exposure you have to such, your immune system may suppress it for a while and you feel better. But next time you are exposed to it, you get another reaction again. So it's common. And then rainy seasons like this, the allergies are actually categorized into seasonal allergies and then perennial allergies. The perennial ones are just all through the year. All through the year. It's common amongst what we call the house dust mites. These are things that probably just be in our beddings, our pillows. Whenever you sleep, you will raise the microorganisms. They are found, they are called house dust mites, which usually are released there by some other things.
Is it not possible to get rid of all of that? Disinfection
is possible.
Well, some persons react to disinfectants.
Yeah, if you're going to disinfect, then you have to also extricate yourself from the environment for a period of time. And we've recommended that the use of rugs in the house. When you walk on the rug, you're actually raising dust out of it. True. And some of these mites may also be there, and they get into the air in circulation, and you inhale them. All right, so some patients, we do have them over the years, be managing this condition of allergies. All we do is to move them away from the allergens, or you move the allergens away from them. Remove all forms of rugs, clear out all those greenish stuff, apply tiles in your walls. That has helped in a good number of families, and the symptoms get better. If you can't take care of the environment, then sometimes we recommend that you move yourself out of that environment. Some patients have to relocate from their abode to somewhere else, and they find that they are living better and the symptoms of catarrh and sneezing ceased when they moved to another location. So it's things you calculate and be able to identify what is causing it before you deal with them.
So we can comfortably say that catarrh is very dangerous if not taken care of.
It's as simple as just common catarrh, but it is as deadly as.
Because from all the explanation you have given, is quite deadly if not taken care of, and it's something that we take for granted.
Yes.
We take it for granted.
Yes.
Now let's look at catarrh and asthma, and asthmatic patients, you know, having recurrent catarrh. What was the relationship?
The relationship really is asthma, as you have allergic rhinitis, have the same pathophysiology in which that is all predicated on allergic reactions. For patients with asthma, there are particular things that the respiratory system react to. But typically for asthma, the symptoms and signs are more domiciled in the lower respiratory tract, which is the lungs and the lung fields, unlike the allergic rhinitis that is mainly upper respiratory tract, right? So above the level of the larynx and above. So in terms of clinical presentation, it's not always the same. Why an asthmatic patient may present with cough, difficulty in breathing, and this peculiar and particular type of breathing, what we call the abnormal breath sound that is called wheezing. It's not always like that with cases of allergic rhinitis that has to do with the upper respiratory tract. But however, it's also documented that an upper respiratory tract allergy can actually also progress into the lower respiratory tract, and the patient can develop asthma. But the main difference for asthmatic patients, there's what we call atopy. Atopy means they must have a familiar tendency. Yeah, you must have a familiar tendency that at least one of your parents also has asthma, then you probably inherited it. Unlike allergic rhinitis, also has atopic relationship, right? So, but the difference is this is upper respiratory tract and the other one is lower respiratory tract.
All right, we have our phone number on your screen there. Please do call. Let's say if we can help each other, particularly understanding catarrh in children. You know, for adults, sometimes you can bear, but with children, it's a lot difficult. You know, they find it very difficult to express themselves, that's one. And you, the parents, cannot really understand what is happening. And so the next thing we do is we're running to the nearest chemist to say, my pikin get catarrh, give me medicine. And before you know what is happening, you're causing more harm to that child. Let's see how parents can understand catarrh in their children, yes.
Yeah, thanks a lot for that. Though human beings are the same, but each group have different peculiarities. For the children, it's quite peculiar that their form of catarrh is also categorical. Right? It's important to say catarrh, we have categorized it, could be due to allergy, could be due to infections, which could be viral, could be bacterial, even fungi. It also can be due to growths within the airway. But for children, it's common. They commonly have just mainly infective situations that produces the catarrh. But it's also important to let us know that children also have the habit of putting things into the wrong places. And so the nose is one common thing they want to put. Little beads, cotton, they just do things like that. So foreign body in the nose is a common cause of catarrh in children. But because it has to be in one, because it will be abnormal for a baby to put foreign body in both nose. So it's typical most times for parents to also be fully informed. If a child is presenting with catarrh from one side of the nose, and that catarrh is foul smelling, the first thing you suspect is there is a foreign body inside the nose. It's always almost confirmed. Once it's unilateral, foul smelling, catarrh. The diagnosis is a foreign body in the nose, right? So that's we have a lot of presentations in the hospitals that way. Then infective cases, upper respiratory tract infection, but we do have in children another common condition of airway challenges due to abnormal growth of certain structures behind the nose and in the throat. These structures are said to be lymphoid tissues, which actually help in fighting infections. Because you observe that the only route into your body system is through your nose and your mouth. All right? The other exit is just the urethra and the anus. Anything that goes into your system is through your nose and your mouth. The other parts of the body, the skin, the sclera, are protective. So when you take in air and there are contaminants and viruses, infective, there is a structure behind the nose that tries to reduce the load of that organism going down. Yeah, that is called the adenoid. Same way when you eat and you drink water, if there are contaminants within them, there's structures within the throat called the tonsils. They help to attract this organism so that the load of this organism going down would have been reduced. So that makes the other defensive structures easy for them to clear. Those structures, the adenoids and tonsils, if they keep on getting so exposed, can start undergoing enlargement. And when they do so, the patient, the baby, most commonly between the age of 1, even from 6 months, can start manifesting with difficulty with breathing and common symptom of snoring at night. But of course, with that, because of the blockage and stasis, bacterial infection sets in, and then they present with catarrh all the time. So it's typical in children. So most times when you have catarrh coming out after a week, it's not clearing, important to see the doctor. First is to identify the cause. Because like I said, the catarrh itself is just a symptom or a sign that there is a problem going on. So the doctor is able to examine, investigate, and so, oh, this is the cause. And when you treat the cause, the symptom will disappear.
Okay, sorry, guys, we'll not be able to take calls. We are going to round up in a moment. So, doctor, quickly, let's look at treatment for catarrh, treatment and management in a minute or so.
Very good. I've just said it earlier. Catarrh is a symptom. There are many causes of catarrh. From foreign body, like I said, in children, from allergies, from viral infections that get secondarily infected, and from even growth, like you said, that's in children. Treatment of catarrh is to treat the underlying cause, the definitive cause. We treat it, the catarrh itself will disappear. Okay,
not that we just run to the pharmacy and you know we do self-med a lot in this part of the world.
The advice,
not that we run to the pharmacy, just get antibiotics, because a lot of us have loaded our kids and ourselves with plenty of antibiotics that those antibiotics have even stopped working.
Let me use a minute to also address that. Yeah, it's quite a disturbing situation we have in our country. The abuse and of antibiotics. It creates the difficulty even in the management of simple cases that would have hitherto responded to some common antibiotics. I think we'll always use the opportunity to stress the fact that we should try to avoid the use of antibiotics. In other climes, antibiotics cannot be gotten over the counter. Right? And we have abused the use now, and the use of antibiotics itself deprives and suppresses your immune system. To the extent we have a lot of people who are now so dependent on antibiotics. Ideally, when you are exposed to infection, the way God created us, our body is so structured that we have things to fight them. But we take antibiotics now and then, we render our immune system null and void, and becomes a problem.
All right, doctor, thank you so much for finding time to be with us on the program. So I've been talking with Honorable Dr. Patrick Okundia, Chief Consultant, ENT Head and Neck Surgeon, a former Commissioner for Health, Edo State, who did very well during the COVID-19 era. And of course, is the MD CEO of Wilborn ENT Clinic here in Benin City. Thank you so much, Doctor, for finding time to be with us. I'm hoping that we'll do this again because 25 minutes is just not enough
Pleasure
to
is mine
discuss
all the
this
time.
issue. All right, guys, we'll see you again. Bye-bye.